Good evening, everyone, and welcome to the inaugural AVEVA webinar series, Laser Luminaries, Transforming Aesthetics with Myria. We are thrilled to have you join us for this exciting event where we delve into the revolutionary advancements in aesthetic technology with our groundbreaking Myria laser platform. Tonight, we are honored to have two esteemed guest speakers who are pioneers in the field of dermatology and laser treatments, Dr. Roy Geronimus and Dr. Hyman Pomerantz. Their extensive expertise and insights will shed light on how Myria is setting new standards in aesthetic care and transforming patient outcomes. We hope you find this webinar informative and inspiring as we explore the future of aesthetics with Myria. Thank you for being here with us tonight, and without further ado, let's get started.
Hi, I'm Dr. Roy Geronimus. I'm a dermatologist in New York City. I am the director of the Laser and Skin Surgery Center of New York and a clinical professor of dermatology at the NYU Medical Center. I specialize in the use of lasers and related technologies, as well as the treatment of skin cancer and cosmetic dermatology.
Hi, I'm Hyman Pomerantz. I'm a dermatologist in the greater Boston area. I founded Viva Skin Dermatology and Aesthetics, and I was trained by Dr. Geronimus at Laser and Skin Surgery Center in New York City, where I learned so much about laser, and also I started working with Myria device.
It's a pleasure to be here this evening to talk about the new laser called Myria from a company called AVEVA. And it's a pleasure also to work with Dr. Hyman Pomerantz, a former fellow of mine, who has been a major source of investigative work on this device, something we began working on years ago, following the development of the technology by a renowned team, including Dr. Rox Anderson, who is the co-founder of the concept of fractional resurfacing, and many other devices that we are all using in our practices today, as well as Dr. Dieter Manstein, who co-founded the concept of fractional resurfacing with Rox, and Henry Chan, who is a leading dermatologist from Hong Kong, who's a brilliant mind and has been terrific in helping to advance this technology. The lead scientist behind this has been Dr. Jay Ballwalker, who we have worked with for many years and has been able to implement the concept of Rox and Dieter and Henry into the technology that we have today. On the business side is Irina Ehrenberg, who has helped to bring this company to fruition. Now here's the team that I had mentioned, and they have been integrally involved with the conceptual development of the AVEVA device called Myria, which is quite unique, as we'll be discussing in this presentation. So this is the actual device itself, which has some unique characteristics that we'll be discussing. What's particularly unique about the device is the fact that it delivers much higher energy than standard fractional devices that are out there today, non-ablative devices, I should say. Has unique cooling mechanism, has unique imaging system, and also is able to deliver a unique pattern of energy into the skin, which you'll see histologically, what is now known as focal point technology, which differs quite significantly compared to standard non-ablative fractional lasers. So this is what is described as a new class of intradermal lasers, the focal point technology that I talked about. Dr. Pomerantz will be talking about the AVEVA site as this goes along, and the AVEVA Sync as well. AVEVA is a company out of Boston, where Rox and Dieter are located, along with Jay Ballwalker and Irina, and they're an offshoot of a company called Blossom, which develops new technology based pretty much on what Rox, Dieter, and Henry spend their time developing. So the video presented here does demonstrate the unique characteristics of the Myria device. Here, this shows the focal point technology at different depths And we often provide a layered treatment where we start deeper and then go more superficially or vice versa in an effort to enhance the benefit of the treatment. So here you see the difference on the left, the focal point technology, compared to the conventional laser on the right. And you can see the extent of the thermal injury, the focus deeper to the dermis, compared to the collimated beam that dissipates as laser energy is delivered with a conventional laser. What we're doing here is we're actually seeing stimulation of collagen. We're seeing stimulation of elastin. There is definite impact on the fibroblasts. And here the cooling handpiece applied to the skin surface allows for a very safe and relatively comfortable administration of the laser light to the skin surface. So what's unique about this is the novel geometry of the laser beam. And you can see here that the laser itself is being focused deep into the dermis in this focal pattern that differs significantly from the standard laser administration that you see below on the bottom of the slide. So we're focusing the energy deep into the dermis as opposed to the linear collimated beam that goes into the dermis and then scatters quite significantly as the laser energy is delivered. With this device, you have the ability to adjust the depth of injury to the skin. The focal point can be lowered or raised depending on what you're trying to do. And in many cases, as you'll see in the clinical part of this presentation, we're actually layering treatment where we're going deeper and more superficially to enhance the cosmetic benefit and the functional benefit from the treatment. The laser itself is non-ablative and is epidermal sparing. There is no injury, there's no wounding, there's no post-operative care required. It's even less painful compared to other fractional devices as well, which has been something that's been clinically important for us in our treatments, and initially was actually quite surprising to us to see that even though we're delivering more than twice as much energy compared to what we were delivering before, we had less pain compared to other fractional devices. And as I mentioned, there is multi-level personalization, so you can adjust your treatment depending upon what you're trying to accomplish, whether it be tightening of the skin, volumization, or lifting. So this is the overview with the focal point technology. You can see the unique ring geometry with the focal point focusing deep into the dermis. You can see the coagulation zone. This is the degree of thermal injury that one sees. There's a healing pattern that occurs during the healing phase. And the healing phase, again, is not necessarily apparent to the patient other than some mild redness of the skin. And subsequently, patients see the rejuvenation. Even though clinically in my experience, we can often see a response very quickly, much more quickly than I would have anticipated than other technologies per se. So you can see here the geometry at 3 different focus depths. You can treat very superficially. You can go at mid-depth for some mild changes in the skin, including volumization, tightening, and some lifting, particularly, let's say, perhaps you want to use mid-depth on the eyelids or the eyebrow area. And full depth is something that we do in all other parts of the face and off the face as well. If you look on the right, you can see the different ring patterns following the treatment, the unique conical geometry that one can see with the different ring patterns based upon whether you're going superficially or in terms of going deeper as well. So you look at the traditional non-ablative fractional laser at 70 millijoules, and you can see the lesion volume is measured here at 0.0596 millimeters cubed. And we'll compare this to the geometry that one sees with the Myriad device, also at 1550 nanometers. So it's a 1550 nanometer device, which again is non-ablative. Here you can see the Myria device at 70 millijoules. So this is not maximum volume, but it's comparable volume to one would see with other types of non-ablative fractional devices. You can see the remarkable histology with this conical pattern, the focal point technology, and measuring the lesion volume, you can see we have a greater volume of thermal effect compared to traditional non-ablative fractional lasers at the same wavelength and same energy. Here, you can actually see with much higher energy at 140 millijoules, the lesion volume is now at 0.2. And this is a significant increase in the degree of thermal effect on the skin surface, or excuse me, below the skin surface, that allows us to get the clinical results that we're seeing. So you can independently adjust the energy and depth, allowing for the full range of energy profiles, and this is very clear in these different histologic examples that one sees at different energies. So by increasing the energy, you can see the changes we can achieve by adjusting the energy per se. And here, the unique ring geometry allows us to go above the 70 millijoules. The device is cleared up to a much higher energy, I believe up to 150 millijoules. And this is quite unique. And what's remarkable about this, as I mentioned earlier, is the fact that it's not more painful. In many cases, it's less painful, despite the much higher energy. So you do see with this elastin staining, the Verhoeven staining, improvement of solar elastosis. This is why the skin looks so much better in the after it's healed. It's gone through the remodeling phase. And we do see a brighter, clearer, more vibrant skin after these treatments.
So this is what the actual Myria treatment looks like. And she had a topical lidocaine 5% on her face for about 30 to 40 minutes before the treatment. And you can see that she appears to be quite comfortable. It's because of the cooling that comes with the Myria. It's very effective cooling, so it adds a lot to the patient comfort during the treatment. And then also the cooling reduces the risk of epidermal and then dermal epidermal junction damage, heat damage essentially, so reduces the risk of PIH.
So here is the man himself, Rox Anderson, using the device. It does have the integrated cooling applied to the skin surface. Again, there's no epidermal injury, there's no wounding. We do give the patients topical anesthetic, which seems to work quite well. We don't need any additional analgesics, no general anesthesia, no pain meds. It's extremely well tolerated. So I'm going to defer to Dr. Pomerantz to discuss the Aveva site.
Okay, so Dr. Geronimus discussed Myria's laser technology using focal point technology and also highlighted its superb cooling technology. I'd like to highlight now Myria is a digitally driven technology, and it's the first of its kind, and it uses the data to accelerate learning and optimization. So one way that it can do it is it's not just a laser device that fires energy. It actually works as a camera tool as well. So this is the photos in the middle, and also right side of the slides are the photos and videos captured by the Myria handpiece. And it has a resolution of that are comparable to the dermoscope that we use in dermatology. It's a very clear pictures, and by capturing these images and later analyzing this in a large quantity will help us create the treatment plans and then also train the laser to utilize the image data in a real time to suggest the parameters that will be most beneficial for the treatment. From a practice management and safety perspective, the digital ecosystem is available. It's called a Veva Sync. And this connects the provider to the patients who receive the treatment seamlessly. And it provides important information on parameter for the treatments that were done automatically. And then also it sets the parameters for practitioner levels. Through Aveva Sync, we can monitor the system's health and performance, and also it can help to diagnose issues remotely if there's an issue with the device. We understand that there can be some technical challenges to implement all different aspects of Aveva Site and Aveva Sync, but we're making good progress, and all these solutions are in progress. A really interesting aspect about Aveva Sync is it can be used as a patient access portal. So these days, patients are used to access their medical record through portals. And similarly, they may expect and they like the option of how their laser treatments have been progressing. So this would allow patients to get on the portal, understand the treatments they received, and then also review their before and after treatments. And then also there is an ability to upload post-treatment or even pre-treatment protocols that can remind the patients. So hopefully they will understand the treatment, their treatment plans fully, and they can be included as part of the overall goal of the treatments. So this is how the treatment is performed with Myria. So first, even before you start the treatment, you can scan the treatment area. This is a very high resolution dermoscopic imaging. And then after that, the numbing is already taken off in this person, and then gel provided by Aveva is applied on all the treatment areas. And this is a very easy treatment to learn if you're familiar with other conventional non-ablative resurfacing devices. So it has, you just glide on top of the skin surface using the handpiece. It's a sapphire window, and it feels really glides very easily. And you treat it multiple directions. And with the Myria treatment, we focus on lifting and volumization, and it comes with the vectoring of the procedure. So as you can see, I am moving the handpiece from bottom to up instead of up and down with the other conventional non-ablative resurfacing devices. And that's on the way to lifting the skin up using the handpiece. And that seems to really help with the lifting after the treatment. Again, you can see that the patient had a topical numbing medication only, and she seems quite comfortable. And the endpoint of Myria treatment is a mild erythema. Again, which is very similar to traditional non-ablative resurfacing device. Some may wonder why the handpiece is too big, because yes, it is true that it is larger than other resurfacing devices. It's because the handpiece houses the camera device equipment. So that's the reason for it. But I have a very small hand. I wear a 5.5 size gloves, and even with that, it's very easy to maneuver the handpiece. And the handpiece is weighted, so actually it feels almost weightless.
We're excited to move into our before and after review segment, where we'll showcase results achieved with the Myria laser. Joining us again are Dr. Geronimus and Dr. Pomerantz. They will walk us through patient cases, highlighting the improvements and the cutting-edge capabilities of Myria. Let's dive in.
Here are some treatments that we've done and before and after photos. So this is an individual in his 30s in skin type, Fitzpatrick skin type 3. and he underwent a Veva Myria treatment. And here's the baseline photo on the left side, and the after photos are 2 treatments after.
So I've treated up to type 6 without any issues. It is a color-safe device, which I think opens up this technology to patients of all skin types.
Yes, that's indeed true. And here, in terms of the results, and we can really deliver the results without having to worry about post-inflammatory pigmentation. So, and here's a close-up view of the skin type 3 patient, and there is an obvious improvement. And here on the other side of the cheek as well. And here's what the healing process generally looks like. So this is a treatment that was done with the medium strength of the device. And right after the treatment, you can notice a mild to moderate erythema with some edema on the cheeks. But the 1 day after the treatment, the redness is mostly resolved. And 1 week after the treatment, the erythema is mostly close to completely resolved. And here's another patient, and she's a skin type 3 as well. And here's the 1 month after the 2 treatment. Her main concern was the skin texture. And this is the VZF photos that highlight the blood vessels. And she had a really good improvement of a reduction of blood vessels on her cheeks and the forehead and chin area, as well as around her nose as well. Again, there's a quite noticeable improvement of erythema on her face. And the next slides point out what her healing process looks like. And again, she had a multi-layer treatment where it was done in a medium depth of the treatment. She was red right after the treatment. The redness fades within a few days. And this is a really exciting photos to show. So first, this is a patient with a skin type 6. And we, in traditional 1550 nanometer technology, we may not even reach out to those options with this skin type. And then another thing is this patient had treatment done at energy level of 150 millijoules. And I can tell you that even after a treatment with 150 millijoules, he did not develop post-inflammatory hyperpigmentation. He had a terrible cystic nodular acne when he was younger.
Dr. Pomerantz, one of the interesting aspects of this slide is that I see an increase in volume, which is something that we're seeing quite a bit in these patients. The volumization, I think because of the higher energy and the focal point approach to the delivery of the laser, is really quite unique. So if you look at this before and after here, the increase in volume is clinically significant.
So yes, that is a very, very good point. And here is another skin type 6. Again, no issues with the post-inflammatory hyperpigmentation. And also he had a post-inflammatory hypopigmentation on this side of the cheek from excoriation of one of his follicular light papules. And also just his overall skin texture looks more radiant, so it reflects the light more evenly. So you can see that there's a better light reflection on the right side of the photo. Here's another skin type 6. And she had 3 myriad treatment to address the overall skin texture concern.
Yeah, you can see on this slide here the lifting of the eyelid. So I would assume this patient was treated below the eyebrow on the orbital rim, not on the eyelid itself. And it's remarkable. This is something that we are seeing quite a bit of in terms of eyelid lifting. It's really quite unique, and patients do notice it. One of the comments I get from women quite often is the fact that they have much easier time putting on their eye makeup, the mascara, that they're not lifting their eyelids as much. It's interesting that the same comment is made by women time and time again. All right, so you can see with this patient, again, dark-skinned patient. Here we're demonstrating the lifting of the eyelid, and not insignificant is the fact that this is a 6-month follow-up. So while we don't see that in every patient in terms of that type of sustainability, here you can see it's quite dramatic. And it's not lost upon me that the fact that this patient has dark skin, and they were able to do something that was really impossible to do non-ablatively without wounding previously. So here you can see the eyelid, and you can see the directional increase in terms of the lifting of the eyelid that we achieved. That's pre-treatment here, and post-treatment you can see the healing is insignificant. As Dr. Pomerantz mentioned earlier, there can be some redness. There is some redness after each treatment. It's not a cumbersome thing. Many of our patients wear makeup right away if it's a woman. And the recovery is really not problematic. It's really quite remarkable that it's such an easy process in the healing phase. So you can see that within a short period of time, we begin to see the lifting of the eyelid. So it's unclear to me why this happens so quickly, but the patients do respond. I get emails, I get calls that they're seeing a response in a very short period of time.
So I'd like to add that the treatment was done just treating the eyelid on top of the orbital rim. So it's not the entire eyelid that was treated. It was the entire face along with the forehead and just the top of the eyelid. And that was able to achieve the eyelid lifting.
So here again, you can see the response following treatment. Surprisingly, we did see there is some diminished redness here as well, along with the volumization and improvement of the overall skin texture. Here, from another point of view, you can see the volumization, lifting or softening of the nasolabial fold, as well as improved texture.
This was a combination of a superficial and medium depth treatment.
And the volumization is apparent here as well. So here's another example where you can see some improvement of the overall quality of the skin, texture, improvement of the eyelids, softening of the nasolabial folds. You can see the improvement of the overall skin quality, texture, dyschromia. Also, if you look, at her nasolabial folds, it is softer. Also on the chin, you can see softening of that crease as well. Now, we've been doing a lot on the neck. I've been particularly pleased with the neck. I would say more than pleased. I've actually been quite surprised with the degree of tightening that we're seeing. The layered approach that Dr. Pomerantz talked about earlier is something that we've been have found to be particularly valuable in the sense that we go over at a higher energy, 140 millijoules or so in the first few passes, and then we'll go back and do a superficial treatment, maybe at 20 millijoules, and this does result in this type of tightening that we're seeing here as well. So it's interesting. Again, as I mentioned earlier, we do see it quite quickly. And I would think that initially I thought that it would dissipate rather quickly as well. If it came on that quickly, it would probably disappear when the edema came down. But that's not the case. We are seeing significant sustainability in treating the neck. And this is, here you can see some improvement in terms of a little bit of tightening of the platysma band here. I don't know histologically how far we're getting into the band. The platysma band is somewhat superficial. So I can't say that in fact we are injuring the platysma band and getting some tightening there, but clinically we do see improvement, so I suppose we are. This to me was very interesting that we are seeing some softening. This is something that is difficult to do without a toxin. I've not seen this before with non-ablative technology, so this outcome to me is quite unique. And there are people, you know, in the clinical world who come in who are toxin phobic. I can't say for sure that we're going to get a toxin-like effect over the long term, but there are softening of the texture. We're excited by this finding, and it's something that we are pursuing presently. Just demonstrating some of the patient downtime, you know, a little bit of redness after the treatment, lasting a few days, generally at most. There is some edema that occurs initially, and until you get used to it, you're not quite sure what it is and that this is a normal finding. We do put a topical steroid on the skin immediately following the treatment to reduce the edema, and this makes everyone much more comfortable with the clinical appearance during the initial healing phase. Here again, you can see improvement that is sustainable. What struck me in this particular photograph is the volumization at 3 months. The cheek has increased volume. Often, on the slide on the right, you can see some softening of the nasolabial fold and the chin as well. Again, another example of some softening of the discoloration in that area. And here, this is the sequence of events that occurs. You can see the redness immediately post the second treatment, post the second treatment as well in terms of the quick healing that occurs, and 1 week afterwards, basically no evidence of having been treated whatsoever. But you can start to see the change at the week. You can see the increase in volume. You can see the improvement of the eyelids. So this is something that is very, very common in our clinical experience, this scenario. Here again, a series of slides. You can see the sustainability of the outcome, the softening of the nasolabial fold. Look at the volumization, look at the improvement of the eyelids. This is something that is quite unique with the Myriad device. No injury to the skin, no change in pigmentation. We're not seeing scarring, so without any healing per se of any significance other than redness, and the safety profile being as high as it is, it's something that gives those of us who are treating these patients a great deal of comfort to know that we can get these types of results safely and effectively.
The erythema papules on these patients are self-inflicted. She has a tendency to excoriate her skin a lot, so it's not related to the laser treatment itself.
Again, extremely difficult to do non-ablatively. So this, to me, is a unique outcome that provides significant benefit to the patient. So you can see this patient at a 5-month post-treatment visit. So really quite remarkable in terms of the ability to get the volumization that one sees here safely and effectively without any evidence of having undergone treatment. Here again we can see some lifting of the eyelids and volumization of the cheek, which is clinically significant to many of these patients. Here again, highly reproducible. Lifting of the eyelid depends on the degree of laxity of the lid. This schematic shows the sequence of events that occurs, the redness post-treatment, the 1 day post-treatment, the redness is dissipating, and 1 week, very little evidence of the fact that a treatment was performed over the whole face. The impressive lifting of the eyelid here is something that's given these patients tremendous satisfaction, and the feedback we get has been very positive. We are starting to see lifting of the lip itself. You can see it looks as though there's a little bit of a lip lift here. We've been doing better and better on upper lip, and there's been very positive feedback from patients who don't want to undergo an ablative procedure.
Yeah, the volumization of the upper cutaneous lip has been really interesting for me to see. So when we see, it's a very subtle change, and patients themselves may not notice it, but in the 45, in the profile view, I've noticed that the length of the upper cutaneous lip, especially in older adults, have shortened after their myriad treatments.
Again, the ability to treat Asian skin, as Dr. Pomerantz mentioned earlier, is a tremendous benefit here. This is a population that's very large on the worldwide stage, so it's just great to have an opportunity to safely treat this patient population in terms of improvement of texture, skin quality, and overall lifting of the skin as well. You can see, if you look at her eyes, you can see that they're wider. So they're just more open than they were prior to treatment. Now here you can see treatments are not limited to women. Men are coming in as well. Men want to look better. Also, I think the ability to treat around the eye with men is particularly valuable to them. A lot of men are surgically phobic. So they're looking for non-ablative options, and here you can see overall improvement of the skin quality following this patient's treatments. No impact on the beard or the hair. And this is, which I think is important, there's no hair loss in treating men over the bearded area. And you can see the overall improvement of the skin quality here, volumization of the cheek, lifting of the eyelid, softening of the nasolabial fold, overall dramatic improvement in this patient's skin. Here again, you can see improvement of the quality of the skin. Rather nice volumization, impressive volumization. Looks like this patient had filler. Improvement of the texture below the brow as well. Overall improvement of skin quality following these myriad treatments.
This patient is in his 70s, and he wanted to look great for his daughter's wedding. He actually never had any cosmetic or laser procedure, but we talked about improving his skin texture and then also dyschromia on his face. And we decided to do myriad treatment together. And again, this patient never had any laser treatment, so there was a little bit of a concern how he's gonna do the treatment, but it was a very easy treatment for him. And then also easy for me. I wanna highlight the ease of the handpiece used with the Myriad. It's ergonomically quite friendly. It's counterweighted, so the weight of the handpiece almost feels like nothing, and I can glide really easily on his skin. And also, patient feels like there is really nothing's like a pressing on the skin surface. And this is the photo after 1 month after the just one Myriad treatment, and you can see that his skin tones look more even, and also there is some improvement of the solar elastosis that he had before the treatment. And also he had a lot of actinic damages, and those were also addressed with one single Myriad treatment. This is another patient of mine in her 70s, and she had facelifting done about a decade ago, and she had lots of sun damage. We can see these etched lines on her face. She didn't want to get another plastic surgery, so we decided to go ahead with Miria. And this is a photo after 2 treatments. And this was a very, very impressive result. Not only addressed the lifting of her cheeks and texture issues on her cheeks, but also you can see that there are improvement of her periorbital lines. And here's another patient, and again, a similar stories in her 70s. And you see that there is a volumization of her cheeks and improvement of her skin texture. And this patient had her eyelids treated with Miria. So I put eye shields in and treated both lower lid, upper and lower eyelids. And she had some swelling that lasted for 2 to 3 days and the redness of the treatment area. It was a very easy recovery for her. And actually, you can see that she has a tightening of the lower eyelids treatment. And then also she had a enlarged blood vessels on one side of her cheek. And I didn't use any vascular laser with her treatment, but you can appreciate that the vessels got even fainter with 2 Miria treatments alone.
Thank you, Dr. Geronimus and Dr. Pomerantz, for sharing those incredible before and after results. Seeing the transformative power of Miria laser in action is truly inspiring. Now, we'll move into the Q&A session with our expert panel.
Well, I think the difference here compared to other erbium non-ablative lasers are multiple. The differences would be higher energy. We can now get up to 150 millijoules. The focal point technology is something that is unique and unprecedented in the laser field. The ability to focus your energy and adjust the energy of the focal point up and down depending on what you're trying to accomplish. The fact that we're able to image the skin before, during, and after the treatments, I think are particularly valuable as well, because that provides us some real-time feedback as to what we're accomplishing and something you can record. So these are some of the unique benefits, along with the integrated cooling system, which seems to diminish the pain quite dramatically as well.
I can answer this. First of all, radio frequency microneedling treatments can be painful. I have a device in my clinic, and sometimes I have patients who can't really tolerate the treatment. On the other hand, the Miria's non-ablative resurfacing is more tolerable, and it is easier to have people to come back for repeat treatment. And then also, there are Miria treatment and the radiofrequency microneedling treatments are similar in that the depth can be adjusted. But Miria treatment is faster than microneedling RF treatment for same density of the treatment. Efficacy-wise, because it can also target the superficial layer of the skin, it is something that you can see with the radiofrequency microneedling treatment. In my patients, I feel like I see it more consistently with Miria treatments.
Well, I've used all of the different devices. I've used all the different non-ablative fractional devices. I've used the radio frequency devices, radio frequency with microneedling, and ultrasound devices as well. And there is a range of discomfort and a range of healing with the various different devices. I would say that the Myria device, even at the higher energies, has the least amount of discomfort. So it's something that is particularly well tolerated. Also, the minimal recovery time is something that's extremely valuable as well in comparison to other devices. The speed of treatment is something that we particularly appreciate in a busy practice, as we can accomplish the treatments or complete a treatment in a reasonable or limited period of time, rather than spending half an hour to an hour in a treatment session. So many of the treatments can be very quick, a matter of 10 or 15 minutes, or if we're treating a more limited area, even faster in many cases as well.
So my patients have been very, very happy with the result. And I've, since I been offering this treatment in my clinic, I've had actually a lot of older patients in their 60s and 70s asking for this treatment. And actually, a few of those patients have had facelifting and they didn't want to undergo plastic surgery again and come to me for laser resurfacing. I'll say really the benefits of Myria is the downtime is not as severe as other ablative laser resurfacing, but still you get results in terms of the improvement of the skin texture and then also laxity of the skin. So it's been it's been a great option for my older patients. Again, it's not doesn't give crustiness or days and days of downtime like ablative laser resurfacing, but still it gives a tangible results. People will come back for their treatments and they've noticed even before me showing before and after photos that they're happy that they've seen some results after just a couple Myria treatments.
In terms of trusting Myria, one has to recognize the forces behind the technology. You have technology developed by Rox Anderson, Dieter Manstein, Henry Chan, and a scientist like Jay Ballwalker. That's a wonderful pedigree, and they have spent years developing this technology to the point where it's now in clinical use. I must say, as one of the original investigators in the Myria device, that there has been painstaking efforts to make sure that the device is, one, safe, two, effective, three, well tolerated, and four, reproducible. So these are specific efforts that have been made that have been accomplished. So I think that someone looking at this device should understand all of the effort that's been made to make this something that is quite unique in terms of outcome and experience. I think the justification for the cost of the device and the treatment is based upon the unique outcomes that we're seeing, as well as the well-tolerated patient experience. And not just the patient experience, but the physician experience as well. Quite frankly, it's a very cool laser. It's quite unique in terms of what it can do. It's very easy to use. It's great when you're treating a patient and they're not experiencing a lot of discomfort, so there's not a lot of hand-holding that's required. In a busy practice like ours, it's wonderful that we don't have to worry about the anesthesia for the patients. We don't have to worry about the post-treatment recovery, and we don't have to deal with post-treatment phone calls from patients wondering about whether or not the healing that they're experiencing is normal. If anything, we sometimes get calls from patients saying, "Are you sure you did anything?" because the recovery is so easy. So I think in terms of justification of cost, cost is based upon outcome. And we're able to provide unique outcomes with the Myria device. The lifting is unique. The volumization is unique. The ability to treat all skin types is unique as well. So there are a number of factors that allow us to justify the cost of the device and the treatments themselves.
Thank you so much for joining us tonight for the first of many Aveva webinars. We hope you enjoy the insights from Dr. Geronimus and Dr. Pomerantz. For more information, or if you have any questions, don't hesitate to contact us. You can reach us at info@avevaskin.com. Stay tuned with us for more updates from Aveva. Have a great evening and see you at our next webinar.